Hello, Toronto. Welcome to our broadcast, Nurses at Noon. It's your favorite nurses, Rachel.
It's your girl, Athena.
And Jordan. Hopefully everyone's having a great day.
In today's segment, we will be talking about occupational health and safety in the nursing field.
Speaking of health and safety, my back is killing me from last night's shift. What was it that you were doing? I was transferring patients from the bed to the commode to use the washroom, but the mechanical lift was broken. Did you use proper body mechanics? You should have been taught how to properly ambulate a patient while you were in school.
Did you report it to your charge nurse?
Well, we were short-staffed, and I was in a rush with all the tasks I had to complete, so I can't really remember.
I feel like I have those days too where I feel overworked, you guys.
You're going to be the ones who pay the price if you're not treating your body right. We lift and move too much on a regular basis to perform any unsafe movement. Even something as simple as raising the bed to your hip level and making it can help save your back in the long run. Repetitive strain can lead to permanent musculoskeletal damage. When lifting, you must always bend your knees and hips and avoid bending forward. Make sure to keep your back straight. If you feel unable to perform any task on your own, ask a colleague for assistance, and remember to always encourage the patient to help as much as possible. Back injuries are the most common injury in the nursing profession. You're right, Rachel. When I'm on the floor helping others, I have to remember to protect myself too.
Ladies, do you think going to the gym will help prevent these back injuries?
Yes, working out is important and absolutely helps strengthen your back and core. You must try to implement at least 30 minutes 5 times a week of exercise. I haven't gone to the gym in so long. I'm so busy with work and I can't find the time to do so. You're right though. Given how much my back hurts, I do need to make it a priority.
Your charge nurse must inform your floor manager as soon as possible to get the mechanical lift fixed because it does increase the safety for yourself and your coworkers.
Not only the coworkers, but the patients too. Can you imagine if everyone at your workplace had a back injury? What would your employer do then? We already are short-staffed, and I can't imagine what would happen if everyone were to get hurt as a result of a broken mechanical lift.
You and your colleagues will not only be mentally, but physically drained as well.
No one ever said nursing was easy, but it should at least be safe. Don't you guys think? I agree.
Me too.
Can anyone listening relate to this? Or does anyone have any other occupational health and safety questions? If so, you can give us a call, or if you'd rather, text us. Our number is 1-800-NURSE-12.
I have a good feeling today is going to be an interesting podcast.
Oh, and look at that, our first caller. Hi there, you're on the air, Nurses at Noon. Can you tell us a little bit about yourself?
Hi nurses, I listen to your show every week. I'm Riley, I work at Lyndhurst Rehab Center. I can totally relate to what you guys are talking about. I'm currently experiencing lower back pain and I was recently changed to modified duty.
For our listeners who may be wondering, what steps did you take when you realized that you were injured?
What I did was I informed my charge nurse and saw my family doctor. Once I did that, they appointed me a nurse case manager. The case manager got in touch with my doctor, received my information, and sent it to WSIB. That being said, all institutions have different protocols, but ensure that you let your charge nurse know about any injuries right away.
Great, thanks for sharing that information. Now on to our next caller. Good morning, girls. I'm Ashley, and the clinic that I work at recently had a C. diff outbreak. All the staff were very diligent with wearing our personal protective equipment, but I'm worried that more could have been done. What do you guys think? For a biological hazard such as C. diff, wearing the proper PPE is exactly what you should be doing. A mask, gown, and gloves are crucial to prevent the spread of infection. If you're worried about more protection, there's no harm in extra hand washing. Ashley, if you have more concerns about your health and safety, I recommend you speak to your manager or a member from the clinic's Joint Health and Safety Committee. It is their responsibility to make sure their employees feel safe at work. Oh, great. That's good to know. I'll definitely look into it. Thanks, girls.
It's great how all of us nurses, regardless of where we're employed, form a community where we all understand each other and can help one another in many different aspects.
I agree. It is important we are able to share our experiences with one another and to continue to grow and learn given our job has so many demanding components.
We have one more caller. Who could it be? Why, hello there.
Hi ladies! I heard Ashley's question and everyone mentioned PPE. What other implementations are there for nurses regarding health and safety?
Hey girl, I didn't catch your name.
Oh, I'm sorry. I'm Sarah.
Hey Sarah, so besides PPE, nurses must go through administrative control measures. What I mean by that is every institute requires certain medical criteria. For example, annual flu shot and TB testing, as well as updated immunization such as Hep B, measles, mumps, and rubella. Also, you must make sure your employer provides an N95 mask fitting. This will prevent exposure from an airborne virus.
Employers must implement prevention, reduce, and manage biological hazards. There are programs such as EPIC, which is employees participating in change, that promote, prevent, and evaluate occupational health and safety in the medical field. I would suggest to ask your employer what programs they are currently involved in or what is available for you as an employee to join.
Thanks, girls. That was really helpful. I'm looking forward to seeing what groups I can get involved in.
Not a problem. Wish you the best of luck.
Now for a text question. This listener has asked to remain anonymous given the nature of their question. They said, I've been feeling sick lately, and to be honest, I'm afraid to tell my manager that I'll need some time off. What should I do? I blame the weather. It's really all over the place and is really starting to affect me. I just need a few days off to catch up to myself.
You should be able to speak to your manager and request sick days so you are protecting yourself, colleagues, and patients.
The first step would be to speak with your supervisor, but if you do not feel comfortable, I would suggest speaking to the HR department in your institution to help guide you through your concerns and advise you on the next steps.
Another option is to speak to your family physician to obtain a doctor's note for your required leave.
Those are both really great recommendations, but remember, it is also the employee's responsibility to be aware of any existing standards, laws, publications, or rules that they may have to abide by. This will reduce the amount of conflict before it starts.
If you have any issues regarding an actual or potential hazard and you are apprehensive about approaching your employer, take note of what the hazard is, the risk, the date, and the time it was seen, and if anyone else witnessed it. Keeping the initial details is important when addressing a hazard.
Generally, hazards must be reported promptly to your supervisor. However, there are exceptions. For example, workplace harassment isn't something you'd have to report, given the sensitivity. In that situation, legal matters could be taken, but a problem like the broken mechanical lift we previously mentioned must be reported, given it's the hospital's duty to fix or replace it.
If you're feeling extremely apprehensive about discussing hazards with your supervisor or feel as if your concerns are not being addressed, you can always file an anonymous formal complaint with associations such as the Ministry of Labor or Public Health. Every issue will be handled differently depending on the level of severity.
We have our final text message coming from Mike at Lake Ridge Hospital. He said, great broadcast. There's so many good questions, but I would like to know what are some preliminary recommendations to apply this information in the workplace.
Great question, Mike. It is required that the head of the organization fully support health and safety for continuous improvement and that everyone involved abides by safe practice to meet the standards and understand that maintaining health and safety is another part of doing their job.
From the employees to the board of directors of the hospital, it is crucial that everyone understands and follows the general guidelines and legislation regarding health and safety. This preliminary step is essential to providing the best care and best protection. No effort is too small when it comes to health and safety.
Absolutely. Preventing a problem is the first step. It's much easier to prevent an issue than to fix one.
As a brief wrap-up of today's broadcast, we spoke about the risks of actual and potential hazards that nurses face on a daily basis, such as ergonomic and biological hazards, implementations such as various PPE, proper body mechanics, what protocols to follow if you get injured on the job, how to approach potential conflict with your employer, and preliminary steps to take regarding health and safety.
Thank you to everyone for listening to our broadcast and for all the great questions that you've asked. Make sure to tune in next week as we will be discussing the effects of dementia on those living in nursing homes and their families.
Nurses out! It's me, Athena.
It's Rachel.
And Jordan!